the dangers of DIY exercises and do-it-yourself programs and copying the programs that your well-meaning friends and family give you. Many patients turn to Dr. Google, social media, YouTube, their friends and family to figure out what exercise they should be doing to help eliminate their pain. Whilst I'm very pro patient education, doing it yourself is just not a sensible idea. What helps one person can make another person worse. When you do it yourself on Dr. Google or well-meaning friends who say they had the same problem, trust me, they do not have the same problem as you. Yes, they might pinch the same nerve. Yes, it might be the same joint. Yes, it might be the same blanket terms of spondylitis or back pain, and it helped them. Yes, it may have done. But what helps one person can make someone else significantly worse and increase their risk of injury. For example, if you've got sciatica because you've got an L5-S1 disc herniation pushing on that nerve, a lot of the exercises you see online are designed when you're about 80% feeling better. And if you do some of them exercises, it can rupture the disc. Similarly, your sciatica could be due to piriformis syndrome, and the type of exercise you do to stretch and decompress the piriformis are completely different than the exercise we'd give you if you were compressing the nerve in the spine. One person needs heat to improve circulation and relax the muscles. Another person needs ice because they need to reduce inflammation to calm that area. What works for one person doesn't work for someone else. There's also different exercises you would give at different phases of recovery. If you've got a herniated disc in the neck, then the early stage will probably be very gentle exercise, reduce inflammation, gently decompressing, light stretches where you might hold it for a short period of time, and even then you'd need to be assessed to find which muscles you should be stretching. But as you get better, we can progress to stronger stretches. But if you do those too early, you could rupture that disc. And this is why, although I'll cover lots of concepts in our videos, I never say this is the exact exercise for you, because I don't know. Once I've examined you, I can give you the right exercise, I can give you the right treatment. But if you have not been examined, then you have not been assessed. If you have not been assessed, then what you are doing is a guess. You should not guess with these types of problems, particularly if you experience pain. Any YouTuber that says this is the right exercise for you are completely false. They have not examined you and they are guessing. And you should never guess with these injuries because they can make you worse if they are not the right ones for you. They make some things better and some things worse. See an expert to examine, diagnose, treat, and give you the right exercises.